I wake up this morning, my injection site is sore. My whole deltoid area is sore. So I'm just gonna still kind of trying to rub it. So hello everyone, welcome back to my channel again. And if you are new to my channel, Jean here. And if you like my videos, please subscribe or like, subscribe and share. So today I was kind of thinking of discussing about health update. So for those of you who have seen me doing my blood work about 4 weeks ago, well, the week after my blood work, I'm supposed to see the doctor, my cousin doctor. I'm supposed to see him for the physical and follow up for my hypertension. But since that week that I was scheduled to see him, we have that snowstorm, ice storm. So a lot of offices, stores and stuff like that were closed. So my appointment was canceled. So it was moved to like yesterday. So finally, I got to meet with him and did all that. And you know how it is, they take your vitals and listen to your lungs and listen to your heart, and then he says you will live for 50 more years. And I said I would like to live forever. So it's just teasing. We joke a lot. Like I said, I used to work for him for 12 years, and he's my cousin, of course, because for those of you guys that have not heard my story about it, one day, of course, I wasn't working. I left him already, but we still kind of keep in touch. We're communicating, messaging, and things like that. It was one Sunday morning, very early morning of Sunday. I got a message from him. He says, "Guess what?" And I said, "Okay, what?" He says, he just got his 23 and 23andMe result. And of course, he says like he's like 99% Western European. He's a tall guy. He's like 6'4", not 5'4". As actually, I would say he is 6'5" or 6'6", something like that. And so anyhow, I said, "Good for you," And then he says, "Would you like to know what's my 0.1%?" I said, "Not really, but you can tell me." So he says, "I'm a Filipino." So I said, "Well, then I can officially claim you as my cousin. You're 0.1%. I'll claim you as my cousin." So that's why I start calling him my cousin. And he was just like, "Yeah, I can't believe that." I said, "Okay, but you don't have the Filipino height, and things like that," but jokingly. So that's why I always call him cousin, and he always when he answered me, he goes, "Cousin." But anyway, so that's the story, how I would say that he's my cousin doctor, but he's 99.9% Western European. He's a tall guy. So anyhow, yesterday where I went to see him, finally after all that cancellation. So we discussed my blood work. Well, everything is pretty much okay. but my blood pressure is still to the roof. And then he says, "Are you sure you're taking your blood pressure pill?" I said, "Of course. I don't want to be just one day drop dead." And I said, quote unquote, "Gorgeous." And then he started laughing. But yeah, my blood pressure is still up to the roof, and I'm actually taking 2 maintenance medication. So he said that he would like to see me back in 3 months instead of 6 months. I said, okay, it's just to kind of monitor, because when a person is getting up with the age, it needs to be monitored and things like that. And I know for sure that the hypertension runs in our family. And so that's out now. That's done. So we're talking about my cholesterol. So the American Heart Association, they have this like guidelines, what the best or normal within the range level for the total cholesterol. When they said total cholesterol, so that means that includes the LDL, which is the bad cholesterol, and then the HDL, which is the good cholesterol, and then they factor in the triglyceride too. So with that said, my total cholesterol is kind of above 200. So yeah, I should say, I have to rephrase it. So the American Heart Association wanting to be your total cholesterol will be 200 below. So with that said, mine is over 200. It was 237. Now that, guys, it's out of the open. There's no such thing as privacy when you're doing when you're vlogging. But that is to me. Some people would still like to keep their privacy intact. Sometimes I was just like, just pretty much just the total cholesterol. So we cannot break it down. Even though I don't need to take any, even though my total cholesterol is 237, I still do not need to take cholesterol lowering pills. Here's the reason why. My bad cholesterol is within the range, just a little bit above the range. But which just, I didn't really pay attention to the number, because I'm focusing on my HDL, which is the good cholesterol. So my good cholesterol, guys, or HDL, is 75. So on the American Heart Association, the minimum number that they would like for you to have your HDL is 40. So they want it 40 above. So mine is 75. That means it's almost double to the required minimum number of the good cholesterol. So with that said, even though my total cholesterol is high, but it kind of factoring it out, it's like a check and balance, like even though the total cholesterol is up here, now this is I'm just kind of looking at trying to kind of get the graph. So this is my bad cholesterol, but my good cholesterol is here also, so it balanced out. So my good cholesterol kind of pretty much flashes the bad cholesterol out to kind of keep it balanced. And even though I have a high number, it's still, I'm good. I don't need to take the cholesterol lowering pills, because that's the reason why my number is high, because of my good cholesterol. So that's good. That's the good part. And my triglyceride also, it's low. So everything with that, in that, pretty much in that scenario, I'm good with that. So so that's good, with that. So I just keep my my hypertension maintenance pill, which I'm taking one in the morning, one kind in the morning, and one kind in the evening. So different kinds that I have to maintain for my blood pressure. And actually, I was thinking this might be the stress also, and sometimes, because I feel good, I don't feel bad or anything like that. So I was just thinking maybe I'm one of the people that has a white coat syndrome. When I used to work for him, I used to work at the clinic. I'm not working at the clinic now. But when I used to work for him or in the clinic, I always tell patients that, you just have the white coat syndrome, because people would say, why is it that it's high when I'm on the clinic, but not when they will monitor it at home? So I haven't had monitored my blood pressure at home, because I'm feeling good. So, and I'm taking medications that I'm supposed to, so I'm good. But when I get to the doctor, even though, I would say I should not have a white coat syndrome, because I work, I'm a nurse, I work for a doctor and all that. But I guess obviously at the back of your mind, I'm one of them. That's my number one excuse. My second excuse is probably the stress, all the things that, my family have been going through. It's just so many factors that affect the stress. Excuse me. And that's probably one of the reason why I'm having that high blood pressure, or, but my blood pressure when I go there, it's kind of high. So with that, like I said, he's not worried about it too much. So then before the visits end, I went ahead and said, you guys probably have seen me having, I had my when I mentioned I had my COVID-19 vaccine also, and I had Pfizer. For my first and second dose, I do not have any reactions at all. My husband, he said his injection injection site was a little sore for like a day, and I did not have that. So yesterday I went ahead and got my booster because it's been like 6 months. It's actually over 6 months. So I'd rather had my booster above 6 months instead of below like 5 months. So I waited till I get my over 6 months period, and I get my booster, and still I use the I asked for the Pfizer. It fell. This is my earpiece piece, but anyway, I asked for the Pfizer also, since I had 2 doses of Pfizer, and I just want to have a Pfizer again for my booster. So I got that done. And I don't know, I'm not trying to scare everyone, because I am what they call it, pro-vaccine. I am pro-vaccine, guys. So anyway, I'm not trying to scare everyone, but I'm just kind of giving you an update and what reactions I might have if I had it, or if I have it. So I will let you know, guys. So anyhow, so that was yesterday. So it's been like 18 hours already. No, because it was 17 hours since I had the vaccine. Of course, when I wake up this morning, my injection site is sore. My whole deltoid area is sore. So I'm just still trying to rub it, But like I said, I did not have that in my first 2 doses. So I was just sitting here, not really doing anything. This is about 11 in the morning. No, it's actually, like 10:30 in the morning. I was like, I can feel. I know this is kind of crazy. I mean, it's that's the only thing with when you are on the health profession, it's kind of like you're trying to dissect whatever symptoms you have, or whatever actions you might have. But I was just sitting here, and I felt chest pain. I felt chest pain, like as if like I had indigestion, but of course it's just on the chest, not on the belly. I feel like an indigestion, like on my chest, and then I can feel the pain on the back too. It's like shooting pain to my back, and I was just like, what could this be? I was even doing like this, guys. I was like pushing my chest like that, because it helps, but only for about 5 minutes at the most. I think that's how long it lasts. But then I'm thinking, okay, am I having a heart attack? And then I was like, what did I do, or what did I eat that could cause me an indigestion? I was trying to think, think backwards what I had, what could it be? And then, of course, like I said, I already forgot that I had the shot yesterday. And then the more I think about it, I was like, wow, the only difference is that I have my booster yesterday. And so I'm thinking, would I have a heart attack from it? And then it went away. So I'm thinking, you heard a lot of things that can possibly, it's a reaction, but some reaction are worse than the other. So with that thought, I'm thinking, okay, I have a high blood pressure. It's just start coming back to my mind. I have a high blood pressure, my cholesterol is high, I should not, what if, all that. So I texted my cousin doctor, my GP. I messaged him. I said, Now I have this, I have this, I have that, and I wasn't doing even anything. Now it falls. This is kind of different, this kind of earbuds, guys, because the more I talk, somehow it kind of like just fall off. Of course, I talk a lot so much anyway. So anyway, I told him, I said that, I have this, I have that, and I really have not had this kind, or ever had this symptoms before. And I said, do you think, I'm thinking, I was thinking, did I get the myocarditis, you know, from this and that? And then he messaged me back. He says, just take ibuprofen. So I'm thinking, so I messaged him back and I just sent him like the emoticon, laugh, laugh, laugh. But those are the things. But the reason I was messaging him, or I'm even telling you guys about this, because I just want to kind of have a diary, just to kind of make sure if I had if I have other possible reactions or whatever could I would be feeling down the road, then I have my first day start. So that's pretty much the reason why. But like I said, guys, nothing to worry about. If that's the case, like, it just makes sense. Ibuprofen is anti-inflammatory, so it's, if you had that, so that would help too. And then it's got acetaminophen with it. So if it's possible, I would say, like I said, I got so much going on in my mind that it's not, like I said, it's not really, I'm not scaring you or anything, but you kind of gave you an idea. If you might have had that, it doesn't hurt to just take like ibuprofen. That's anti-inflammatory medication that would help too. But yeah, and look at me now. It's been 2 hours since I had that problem. I mean, not problem, a little bit of an episode. I called it an episode. So I'm just gonna trying to make sure that if I have another episode, then I had it documented. When did it start? It's just pretty much what I'm trying to say. And then you guys, if you have some kind of episodes also that you might think you haven't had that before, but it just started after I got this, I got that. It's sometimes, like I said, it's just a normal reaction, because our body fights whatever viruses that comes to in our system. So it's just normal that there might have some reaction, and then sometimes they just don't have reaction, which is good. Like I said, I never had any reaction for my 2 doses. But anyway, that also excuse me, that I kind of feel like after that I had that episode, I feel like it's going down, up and down on my carotid area, and it's kind of like down on my, it's only on the right side because this is where my vaccine was. It's kind of like on my clavicle. I'm thinking, would I die? Of course, it's not really that bad, but I'm just saying, it's kind of nice to we can talk about it, and there's nothing to worry about. There's nothing to be scared. At least if anything else, we kind of share an experience and get some idea, excuse me, of what we can take if ever we have that, and then, like I said, just kind of monitor if you have any more episodes or what other episodes that you might have had, and just comment below also, and you can document that in case, then you have like a diary to go by when you documented what you feel, and then you can like eliminate this and this and that. Because I'm thinking, okay, at first I'm thinking I might have a heart attack, but then when I try eliminating things, I'm thinking, no, I did not have a heart attack. This is just probably a reaction, from my from my vaccine. So, well, of course, my doctor kind of attest that. So I'm good. So I'm good for now, guys. So thank you for watching. I hope you learned something today, but don't you ever get scared and not to get vaccine because for that reason. No, it should not be. It's always nice that we can talk about it. So that's what I'm just gonna my first health update for the year. So thank you guys for watching, and I will see you back soon. Bye guys.